Namaskaram Andy. I am Dr. Ravi Shanker. I am a senior consultant cardiologist to Virinchi Hospital. Today we are celebrating Heart Valve Disease Awareness Day. In India, at least 30 million population, they are suffering with some or other form of heart valve disease. But unfortunately, 3 out of 4 they are unaware of that, number one, or they know little only about the heart valve disease. Today we will speak about the heart valve disease, what are the heart valve disease, what are the symptoms, and what is the best preventive method and what is the best treatment method. In heart, there are 4 valves are there. One left side mitral and aortic valve, right side tricuspid and pulmonary valves are there. Any dysfunction of the valve is called mitral valve or tricuspid valve or pulmonary or aortic disease. That means the valve has to move like this. If it is a restricted movement, then we call it is a stenosis. If it is a not restricted, it is coaptation problem, then the blood will go from down to up. So that is again a regurgitation disease. Either of these, any of the 4 valves causes some, definitely if you treat immediately, you can restrict the progression of the valve. If you don't treat immediately or in early stages, then patient will lead into multivalvular disease and heart failure and ultimately leading to death. So mitral valve and aortic valve are the most important because it is in the left side of the body. Most of the cases in India, what we see, that is the rest of the world and India, then means Western world and India, what we see is absolutely a rheumatic heart disease. This disease starts from age 6 years to approximately 20 years. This is because of overcrowding in India, infection because of streptococcus, beta hemolytic streptococcus. The patient will develop sore throat, fever, and then followed by some joint pains, severe joint pains, arthritic pain, and some subcutaneous nodule, erythema marginatum, maybe chorea-like activity like in syndrome, and followed by patient will develop valvular heart disease. And if you treat immediately the rheumatic fever, which is a very important, then patient may not have a heart valve disease. So at this stage, only early stage, if the patient is at the age of 10 years, patient developed rheumatic fever, if you give proper primary prophylaxis and secondary prophylaxis and the treatment, patient may not lead into heart valve diseases. So once the patient will have, most of the time even we detect the heart valve, patient is coming for the pregnancy, then we detected, yes, patient is having mitral stenosis. So accidentally, patient coming for some other reason and by doing routine tests like echocardiography, then only we detect that patient is having some heart valve. Once the patient is having any valvular symptoms like patient will have a breathlessness, patient will have a palpitation, sometimes patient will have a chest pain and syncopal attack, fatigability, pedal edema. These are the few of the generalized heart valve symptoms will be there. Any patient having all the symptoms which I have told, if they are having, please consult the nearest doctor and get it done one 2D echocardiography, which is prettily available in district level also. You can even diagnose with any of the heart valve disease is there or not. Once you are diagnosed with heart valve disease, don't panic. Everything nowadays, so much of latest treatment came without surgery also. there is very good treatment, and we at Virinchi hospital also, we are doing TAVR, means aortic, severe aortic stenosis, which we are doing. That is also TAVR procedure we are doing. Number two, mitral valve replacement, and tricuspid valve also we are doing. So all these things, we have two choices. One is percutaneous without operation, second is with operation. Once the patient underwent any either TAVR or aortic valve replacement or percutaneous, then he has to take few tablets for aortic. Suppose operation mechanical valve, he has to take some few tablet lifelong, and he has to check the PT-INR. If the PT-INR is normal, patient will lead into normal life. The quality of the life will improve. So treatment is absolutely very, very important. If the patient require any operation or not, patient is not required any operation, that only the doctor will decide. Again, that depend upon mild to moderate disease or a severe disease. As per that, doctor will decide. Please consult the doctor. And if you have any symptoms like palpitation, breathlessness, or fatigability, or chest pain, please consult the doctor to find out whether all the heart valves are absolutely working normal or abnormal. Thank you.